call is being made to include mental health services at primary care institutions. This as the challenge of shame and stigma of the mental health disease remains at large. The Ministry of Health hosted a workshop to discuss the models of mental health care. Marie Hull was there and files this report.
According to the World Health Organization, 1 in 4 people will be affected by mental health or neurological disorders at some point in their lives. By definition, mental health is a state of well-being in which an individual realizes his or her own potential to cope with the normal stresses of life and is able to make a contribution to his or her community. However, right here in Trinidad and Tobago, experts say the stigma associated with mental health illness needs to change, and integrating a mental health system at regional health authorities can help. On Tuesday, at the opening of the Ministries of Health Models of Mental Health Care 2-day workshop, Permanent Secretary Charlene Phillips said the topic of mental illness has been treated as taboo. She said some citizens are of the view that persons living with mental health disorders only reside in northern countries, such as in the United States and Europe. In addition, she said the fear of being stigmatized has also prevented persons from seeking the help they need. She believes setting up community care alternatives can educate and assist persons living with the disease.
Because of the stigma accompanying psychiatric disorders, patients and their families try to hide mental problems and avoid applying to the official mental health system. Little change has been realized by the mental health system in terms of perception of mental illness. Governments should move away from large mental institutions and towards community health care and integrate mental care into primary health care and the general health care system.
According to Ms. Phillips, studies show that depressive disorders are the 4th most common cause of disease in the world, and large mental institutions are not fully equipped to assist every person affected by a mental health issue.
That large mental institutions no longer represent the best option for patients and families. Such institutions lead to a loss of social skills, excessive restriction, human rights violations, dependency, and reduced opportunities for rehabilitation. Countries should therefore move towards setting up community care alternatives in a planned manner, ensuring that such alternatives are in place even as institutions are being phased out.
The objective of the Ministry of Health Models of Mental Health Care workshop is to present and review the existing models of mental health care within the region. Marie Hall, CNews.